Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College. Today we're going to talk about occupational health, an area of work in public health to promote and maintain highest degree of physical, mental, and social well-being of workers in all occupations. My guest today is Dr. Michael Crane, the Medical Director of the Selikoff Center for Occupational Health and of the World Trade Center Health Program Clinical Center of Excellence in the Mount Sinai Health System, and a professor of environmental medicine and public health at the Icahn School of Medicine at Mount Sinai. Dr. Crane, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you so much for having me.
It's so good to have you to talk about this subject. So before we get started, tell me a little bit more about you and why you decided to dedicate your career to occupational health.
Well, it's been a bit of a twisting path, my career. I started off as a general internist, and I thought I wanted to practice general medicine and cardiology. And what really happened was that one day, towards the end of my training, I didn't have a job yet. And so I was still saying, well, what am I really going to do? I know about the MD title, but what am I going to do? And I was in our little library at Montefiore Hospital, and I was a little bit at loose ends, and I was just kind of strolling around. I didn't have patients that day. And I saw this little red book lying on the table, and I picked it up. And it was a book of essays by this guy, Irving Selikoff. And I had heard the name. I knew, for example, that Dr. Selikoff was very famous. He had done work on asbestos. And I didn't know that much more about it. And I started to read the essays, which entailed, going to the workplaces, talking to workers, especially asbestos workers, talking with them about their exposures, looking at their x-rays, looking at their diseases, going back to them and saying there's something going on here, it's related to maybe to this asbestos exposure. And then taking the skills of medicine, right, and taking that intense focus that we get on our individual patients. And Doctor, you know what I'm talking about as well in that situation, I'm sure. And taking it out and turning that around such that it became a mirror and a beacon looking out and shedding light on the workplace as a source of illness. And I was transfixed by that. I just said, whoa, it took the normal patient-physician situation where we're sitting in an office together, and it stood it on its head, really. And I thought this was just amazing. I mean, since that time, lots of people have done it and lots of people have done it before, but I guess I was pretty naive because I was stunned by this. So the first opportunity I got, I took a job in industry. I found it very interesting and very satisfying. I was working at the New York Post Office for a while. Lots of Vietnam veterans at that time with lots of issues residual from the war and other issues related to the work. And after all, I was completely hooked. I found working with New York workers in general to be rewarding and challenging, and their generosity to us medical professionals as we kind of stumble along and try to make sense of their exposures and what might happening to them is just extraordinary. And I became the medical director of Con Ed for a while, which was a wonderful experience. Great management, great union, fascinating to be inside those big old powerhouses when they're still operating. Lots of exposure to asbestos because what did you do when you had heat and you wanted to not have fire spread, you put asbestos on it. That went all the way back to World War II. And so that residual was operating not only at the powerhouses, but all around New York City. There's still lots of asbestos in New York City because of that reason. And that led me again to kind of be hyper aware of the dangers of asbestos during the attack on the World Trade Towers. The towers, as you know, were lined with it. And when we were just starting to look around at the site and make sure everyone has respirators to protect them, et cetera, we would find that in just ordinary manholes, for example, you walk into one manhole, it would be laden with asbestos.
Wow.
You could see it on the ground. You could pick it up in your hand. Of course, you don't want to do that. You want to have your respiratory protection and your suit and everything, but it was everywhere. You'd go a block to the next manhole, and it was pristine. So there was this splotchy exposure to this toxin all over the city, and that was characteristic of the World Trade Center site as well. As you moved through there, you'd be in a perfectly pristine area. Some of the guys would then go lift a beam, and flame and soot and chemicals and terrible smells would come out. So it was a very intermittent exposure. So these type of challenges that I've run into, I find them, God help me, I find them fascinating. I know that when I'm with a team that can address them and protect workers, that we can really protect from significant injuries. And so the career for me, just for that reason, has been extremely satisfying, and I hope to get better at it, even now.
Yeah. So tell me, you speak about the asbestos portion of what you do. How about people every day going into very differing kind of work environments? Besides asbestos, what would be some other kinds of very dangerous things that we're inhaling or that may affect us in our workplaces or spaces? Sure.
Well, it's, the infrastructure of the city is pretty old, right?
Yeah.
We've been around here for a while in New York. Plenty of lead, plenty of lead wiring, plenty of lead piping. When you cut that, you get lead dust. Yeah, you can breathe it in and have your lead levels go up, even without realizing that you are breathing lead sometimes if you're not well educated. If you, for example, thank goodness we now have, it's very prevalent to have no smoking in workplaces, because if you had a cigarette, right, and you were smoking, let's say you were smoking in a manhole, and some lead dust got on the cigarette, you would have an expedited lead exposure, because the cigarette would turn the lead into vapors, and into your lungs the metal would go. So all of these little things and add up.
And I guess mold, you got to think about mold as well.
I beg pardon?
Mold and how that affects also some people.
Yeah, sure. I mean, if you don't mess around with mold anymore, right? So if you have a moldy, you have some baseboard or something in your apartment, and you look at it, and if you're not confident, get somebody to confirm it's mold. You cut it out.
Yeah.
You don't waste time with mold trying to fix it. You cut that out and get rid of it. You see mold, out. And because you do not want that long-term exposure. You don't even want to bother going in and identifying the species and all the stuff that we used to do. No, just cut that stuff out of it.
Cut it out.
And, it's in the long run, it's cheaper, right? You eliminate the threat to yourself. B, and you can be confident after you do that removal, because it usually doesn't seep through into, it doesn't really attach to concrete extremely well, although you can have it. And then you have a different situation. You remove that mold. Don't wait to see the speciation. Get it out.
Get it out. So what would you say? I know for some people who travel to Manhattan or other very crowded areas, that they can be exposed to these things that they can inhale. Would you suggest wearing a mask just because you may come in contact with these things that are really hazardous to your health? What do you suggest us wearing so that we are not putting ourselves at risk?
So I've ridden the subways a lot. I'm pretty sure you've probably been on the subways too. I remember, and this prejudices me. I will freely admit that what I'm about to say to you is not fully versed in science, and it probably is supported, but this is not definitive. This is me because of my personal experience. I was a much younger guy. I was in the subway. I stood up to get off, and I was walking past a very nicely dressed group of people. One of them turned and coughed right into my face, globs of material, mucus. And ever since that time, I've been very pro-mask in the subways. Now, that is not science. It is not anything but personal experience. But I feel, I'm over 65. So I feel that, in a COVID and flu type environment, for people of my age, certainly, I highly recommend wearing a mask.
And you're talking about a surgical mask or N95?
So I have to say, I find an N95 a little bit difficult. When I'm wearing it, I'm not always comfortable. I find that even when it's well fitted, there's a little, when there's a little bit of excess heat, discomfort feeling. Not always, but certainly climbing stairs and doing stuff that has exertion. I find it a little bit uncomfortable. So for me, I go to a surgical mask.
Okay.
Now, I don't recommend that for everybody. And in fact, the science of that is probably very debatable. But nevertheless, for myself, and I think in general, for people of my age who have that vulnerability over 65, I recommend a face coverage certainly to my friends and family. And I would urge others to consider it. I know it's a very hot topic in some areas. In some areas, it's completely accepted. And I'm not trying to be dogmatic here.
But it's protective.
I'm saying, I think for me and for people of my age, I certainly feel more comfortable with a mask, and I presume others would as well.
You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about occupational health, an area of work in public health to promote and maintain highest degrees of physical, mental, and social well-being of workers in all occupations. My guest today is Dr. Michael Crane, the medical director of Selikoff Center for Occupational Health and of the World Trade Center Health Program, Clinical Center of Excellence in the Mount Sinai Health System, and a professor of environmental medicine at the Public Health at Icahn School of Medicine at Mount Sinai. So, Dr. Crane, I know that's part of what I really recommend to my mom, who's actually over 80, when she goes into those subways to wear a mask. It's protective. Tell me more about the Selikoff Center for Occupational Health and the World Trade Center Health Program Clinical Center of Excellence in the Mount Sinai Health System. Tell me and explain to me that program that you have.
So just to continue, and thank you for the question, just to continue with this story about Dr. Selikoff, he was at Mount Sinai for many years, and his colleagues saw the need and the opportunity to have working people come in. Back in the day, it was people who had been exposed to asbestos and other substances and might be getting the pulmonary toxicity, and keep an eye on them, follow them up with x-rays, make sure they had appropriate respiratory protection, et cetera. So that became the basis of that population. Subsequent to that, representatives from New York State looked at the clinic and said, this is a really good idea to have around the state, and formed up a network of clinical sites that stretches all the way from Buffalo right across to Rochester, to Syracuse, to Albany, down the Hudson Valley, such Rockland County, for example, down into Manhattan, where there are two locations, one at Bellevue, NYU, and our own Selikoff Center, and out in Long Island, where Northwell has the Occupational Environmental Center for Long Island. And the idea was to put experts in occupational medicine in these sites to be consultants to unions, consultants to businesses, see patients who simply had concerns about workplace exposures, follow up illnesses and injuries that happened at the workplace, lifting injuries or back injuries or any type of general arm, back fractures, any type of workplace-related injury, and then try to develop programs to prevent those injuries in each of those industries and each of those locations. Of course, it's a free enterprise market, and no one can force workers or an employee or an employer to either have us in or invite us in or whatever. But what we try to do is educate the workers who come in with injuries, tell them we'd be happy to talk to their employers, that we have some ideas about maybe how to prevent exposure or injury. And just by being that, inviting folks, we've gotten a lot of folks to take up our services and be willing to discuss with workers, with unions, amongst employers, various types of protective measures. Just an interesting one for me, and as you're a professor of nursing, I think you might like this one. We like lots of places, we switched over to I call it Zoom care. We would be doing these televisits and telediscussions, and at one point, we had encountered one of the unions who had a large number of home care workers. Now, as you recall, in the beginning of the pandemic, it was a really scary time. Yeah. I mean, the whole concept of what exposure got you sick was not that clear. And, is this an aerosol or these droplets? How far away do I have to be?
Right.
And we're talking to a group of people whose job it is to go into the home of sick people and take care of them so they don't wind up in the hospital. And as you recall, at that time, going to the hospital, you were going to be exposed to even sicker people, right, who might have COVID. And the transmission and how it happened and through which meetings it might happen was pretty uncertain. So the whole idea was to try to keep these very vulnerable patients in their homes, and to do so, have the home care workers confident that they could be protected and do their job. And I must tell you, one of the most inspirational chapters of my life was hearing the dedication of those home care workers.
Yes.
Almost regardless of their own health, that they wanted to be in with their patients. They wanted to take care of the people, their people, and keep them well. And I found this absolutely inspirational.
Yes.
I remember to this day talking to the other attendings about it, how inspiring their dedication was. And what we found was, with a good bit of education, a little bit about ventilating the room properly, making sure they had a mask. If they could get a 95, get the N95, wear it, wear the surgical mask if that's what you could get. Distance, protection, ventilation. And I think we did very well in protecting those workers. And I'm so glad of that. But I must tell you, doctor, to this moment now, I still find the thought of talking to those workers and the experience of that, talking to those workers, absolutely inspirational. They are heroes, period.
Yes, they are heroes. And we do recognize that. I know a few months ago, the center received more than $12 million in 2 new 5-year contracts from New York State. Yes. So tell me how this money is being used.
Oh, I bought a large place on the Riviera. I think my Sinai keeper there just turned me off. So each year we fund a certain amount of medical positions. So physicians who'll do examinations and recommendations. We have industrial hygienists who go and who will go and actually do chemical measurements or look at chemistry in the workplace and try to devise protective. We have ergonomists who will look at the tools that are being used, the workplace furniture and the accoutrements of the workplace to make sure that the tools that are being used are properly mounted, properly seated, will not contribute to injury. So it's a variety of measures and skills and talents that we bring in. So we hire professionals. We have professionals on our staff. We bring in excellent folks to actually manage the patients and be our communicators and stay in touch with the patients, make sure, when they go, okay, you need lung cancer screening, let's get that set up for you, all of that clerical stuff. So it's mostly the salaries of professionals. There's some budgets for equipment, like if you want some special measuring equipment for various types of chemical exposure. But it's essentially staff who have the ability to teach those preventive skills, to examine those patients who get injured, and then to get them back to work and beforehand make sure that workplace is going to be healthy for them. So the actual award is, in addition to paying the rent, of course, mostly the personnel who will carry out the mission. And I do confess it's not on the Riviera at all. So I'll stop there.
So tell me, how do you choose the work environments that you would go in to canvass or help with surveilling those potentially hazardous areas? And, is it by phone call or is it by just patients who come to you who suspect that their work environment is unsafe? How do you choose?
All of the above. And, I'll tell you one particularly difficult one that we've been having, and it just gives you an illustration of the type of working through a problem that we do. So those lovely looking countertops that everyone is getting, right? They look like marble and they're smooth and sanded and everything. In some of those countertops, you find toxic dust as the workers work them and sand them down and what have you.
They come from the recycled bottles, right? Plastic bottles.
Well, it's not so much that, it's the actual content of this material that will be involved in the formation of, say, a countertop. And workers who sand the countertop without adequate protection can inhale the dust, and the dust can be toxic to the lungs. We've been talking to people in California about how we can address that issue, and we've gotten a lot of good advice. But we can't find we had no luck finding the locations in New York, in our area. So we've talked to everybody on our network in the New York State Occupational Health Network to be on the lookout for these types of kitchen air, standing, fabrication type places that are there to improve, the appearance of homeowners' kitchens. With great frustration, we cannot find the workers or find the locations. We know that they're here. Maybe they're not right in New York State in our area, but we know that the work is being done. It's not secret. It's just that these things, the people are unaware of the problems, and these things don't get advertised. So there's a real amount, and this is my long-winded way of saying that, in this business, in occupational medicine, there is a great deal of detective work, not by cops, but by us. Mm-hmm. So you go to a location and you realize this worker, right, had this exposure to this chemical because you've seen it before and you've seen the impact, and you say, that looks like XYZ exposure. And then your job is to go out and see if you can find XYZ. And it really is sifting through records, looking at machinery, looking at processes. So again, in my roundabout way, occupational medicine is a lot more than medicine. It's actually understanding workplaces, understanding the language of workers, educating workers so they themselves can be the ones who identify toxins and protect themselves against that and protect other workers against it. And when it works best, when occupational medicine works best, it's when those workers knock on a door and say, here's something. We think we know what this is. Get yourself out here and check it out with us. So educating those workers, educating the workers as to the toxic exposures, for my money, is where we should be really aggressively undertaking our preventive measures. An educated worker is the person who is going to save his coworkers and who's going to direct a guy like me to the place where I can help correct the process. That education is paramount. And a lot of that education, Doctor, I think is actually done by nurses.
Yes.
It's when they're leaving the doctor's office, right? And they have the conversation with the nurse. The nurse is the one who finds out all the important information and gives those pointers, and then says, "Well, come on back," and the doctor will have to talk to you about that. So the nursing partnership in occupational medicine is absolutely critical.
Oh, it's critical. Yes, I see that. So how do we get in contact with you?
So the best way is truly through the Mount Sinai website. I'm right there. Click, and you can see me, Dr. Michael Crane. I think that's the quickest and best way. The other doctors as well. I think that whole setup in which the doctor, you see your picture, you see the phone number, contact information, drop an email, pick up the phone. We will have people answer. And when it's due to a problem of some time, we will be promptly back to you.
Well, that's certainly good to know. So we just want to say thank you for being here, Dr. Michael Crane, the medical director of the Selikoff Center for Occupational Health and of the World Trade Center Health Program Clinical Center of Excellence in the Mount Sinai System, and a professor of environmental medicine and public health at the Icahn School of Medicine at Mount Sinai. We thank you for giving us this very, very important information that we need to know, and we hope you continue to still do the great work that you're doing. So thank you.
Thanks so much. Thanks so much, Doctor, and thank you for not mentioning my Riviera. I really appreciate it.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.